All right, so we're moving on to the next gynecological issue. So we're talking about the endometritis. So to me, anytime you hear them talking about itis, basically you're talking about inflammation. So endometritis is like there's inflammation of the endometrium. All right, there's inflammation of the endometrium. So this endometritis is just inflammation of the endometrium. That's the inner lining of the uterus. It's typically caused by what? Bacterial infection. Right? You have virus infection, you have yeast infection, all this fungi stuff. But typically, when they say typically, 80% of cases, you actually see what? A bacterial infection. So it can be acute, that's all of a sudden, or chronic, that's been there for over a long time. It's especially common after childbirth, miscarriage, or gynecological procedures like maybe cesarean sections or intrauterine device insertion. So causes is all those postpartum infections. Alright, so maybe after a cesarean delivery, the wound was not properly taken care of, so infections came in. Sexually transmitted infections, pelvic inflammatory diseases, there may be procedures, also tuberculosis can cause it. Alright, so symptoms is the woman is having fever and chills, alright, especially with this bacterial infection. So the bacteria is actually going into blood, so cause sepsis, lower abdominal or pelvic pain, vaginal discharge, alright, or bleeding, pain during bowel movement or urination, general feeling of illness or fatigue. So diagnosis is this: pelvic examination because you want to check for tenderness and discharge, endometrial biopsies because you want to detect inflammation and infection. Ultrasound may show a thickened or irregular endometrial lining. Blood test, then cultures. You're doing the culture because you want to actually dictate the specific organism that is causing that issue. So treatment is, if it is bacterial infection, antibiotics. Then the woman is bleeding, she's losing a lot of fluid, so you stabilize, you resuscitate. There's intravenous fluid and hospitalization. Then treating sexual partners, right? Surgical removal of the tissue if needed. Sometimes you are doing that because you want to prevent cancers coming up.